Hello, and welcome to the Tampa VA's Inpatient Psychiatry Rotation Orientation video. I'm Dr. Kimberly Gronemeyer. I'm the psychologist on the ARC, otherwise known as the Acute Recovery Center or Inpatient Psychiatry. During this video, I'm going to tell you a little about myself and this rotation while also giving you a peek at the inpatient unit. So about me, I'm currently the only psychologist and primary intern supervisor on the ARC, but we have an opening for a second psychologist who would also be an intern supervisor. I've worked on the ARC since 2009. In my prior life, I worked as a forensic psychologist in a close custody prison and at a state forensic hospital in Virginia while doing part-time forensic private practice work. I transferred back to my home state of Florida for a position at the Tampa VA for the warmer weather when there was an opening for an inpatient psychologist that I felt would be a good fit with my skill set. My primary interests are severe psychopathology, personality disorders, and personality assessment. My primary theoretical orientation is DBT. Okay, so now let me tell you more about our inpatient psych unit. The ARC is a 40-bed crisis stabilization unit that serves a diverse population of all races, ethnicities, ages, religions, genders, and sexual orientations. Veterans can be admitted voluntarily or involuntarily due to suicidality, homicidality, or inability to care for self due to mental illness. Veterans present with a broad range of psychopathology, including depression, bipolar, psychosis, PTSD, anxiety, personality disorders, substance use, cognitive disorders, and more. While the average length of stay is 3 to 7 days, we do have some veterans that stay much longer. The ARC is actually composed of 2 attached units. ARC 1 is our more acute males under the age of 65. ARC 2 is all our geriatric and female identifying veterans, as well as our less acute males. Currently, ARC 2 is under renovation to upgrade some safety features, so I'm going to show you a glimpse of that unit. This is a view down the main hallway with offices along both sides. This is an external view of the ARC 2 nurses station. It's actually much smaller than the one on ARC 1. This is the view from the nurses station down both corridors and into the day room. Here's our day room where veterans would relax, watch television, eat meals, and meet with visitors. Here's our group room. It has rocking chairs and a whiteboard. We have an outside area for patients to relax and get some fresh air. Groups are sometimes held out here as well. All of the patient rooms are either single or doubles. Here's a single room. Each room has a private bathroom and window. Furniture is still on order. And here's an example of a 2-person room. This is one of our 5 treatment team rooms. And lastly, this is a partial view of my office. When we are operating at full capacity, we have 5 treatment teams for our 40 patients. Thankfully, psychology is not expected to see every veteran on the ARC. Instead, I only meet individually with veterans referred to psychology by one of our teams. The treatment teams consist of a psychiatrist, psychiatry residents and students, a social worker, and nursing. Psychology is an active part of the team, and our input is highly valued throughout the course of the veteran's treatment. Interns receive daily experience interacting with the teams where they learn how to provide feedback and navigate team dynamics. Psychology's 3 main services on the ARC are individual and group therapy, as well as psychological assessment. With regard to individual therapy, we might provide psychoeducation and coping skills to help veterans better manage and understand their mental illness. Because of the short stay, brief interventions are preferred. I am typically not able to utilize formal EBTs that require several sessions and weeks to complete, but I do pull from a variety of modalities, including DBT, CBT, MI, ACT, Seeking Safety, etc. I follow the mental health recovery model and focus on meeting the veteran where they are and establishing short-term goals for their hospitalization together. I want veterans to have a positive therapeutic experience that will set the groundwork for outpatient engagement and treatment and keep them open to returning to the ARC in the future. Given the fast-paced environment of the ARC, we are in constant communication with the treatment teams. This necessitates that I meet with my interns throughout the day to ensure accuracy of any information communicated to the team. Interns tell me that they receive much more supervision on this rotation compared to others because we typically meet both before and after you see each veteran. I will have you observe me with veterans, then we see them together, then me observing you, and then you seeing the veteran independently when we both feel comfortable with you doing so. I've taken interns with significant inpatient experience who might move quickly through these stages, and others who are new to the inpatient world who move more gradually. I'm more concerned with seeing some growth in your skills regardless of what level you are starting from. If you've never worked on an inpatient psychiatric unit, I highly recommend this rotation. You will have the opportunity to see patients in acute states of crisis, mania, depression, and psychosis that you just won't see anywhere else. This will make you a better clinician by helping you hone your diagnosis and treatment skills. Each day is different with no set schedule. You have to be flexible for unanticipated crises and utilize good time management. Every day is different, so it's hard to get bored here. But it's a great place to experience the essence of severe mental illness and gain confidence in your ability to diagnose and treat any condition you might encounter, regardless of what direction your career takes you. I hope you found this presentation helpful, and I wish you each the best on your intern application journey. Take care.